We are called to help each other. We are called to love our neighbor as we love ourselves. So we love ourselves by self-care. Now we're going to love other people. So Jesus didn't say love the easy ones. Jesus didn't say love the ones that have it together. Love the ones that don't need medication. Jesus said love. Just love, period, the end. Let's talk about factors that contribute to suicide among those with and without mental health conditions. Yes, diagnosis of depression, anxiety, PTSD, but I lost my job, was caught in some bad decisions, was humiliated, believed that, we know how small towns are, believed that no one would ever believe me, no one would ever care, that this would be blown completely out of proportion and made so much worse than it actually was, and I would have rather died. So 2 weeks, that's the crisis point. 2 weeks in the past or 2 weeks in the future, I can't possibly live through this. That's the lie we believe. There's not possible. This will never get better. This will only get worse. Those are the lies we believe. Those are the lies that shame tells us. So here's where it starts. It starts with listening. Listening to your coworkers, listening to your children, your spouse, your Sunday school friend, whoever. Elderly people die by suicide, teenagers die by suicide, white people, black people, men, women, straight, gay. Lots of people die by suicide. There's not one contributing factor other than despair. I feel completely hopeless, and this is my only way out. So somebody just comes out and says, man, I just feel hopeless. This sucks. This is terrible. This is hard. I can't. This is the worst thing ever, right? Okay, well, tell me about that. Ask. And asking is vague sometimes. It's, are you okay? Is everything all right? But the best thing is, hey, are you thinking about hurting yourself? Are you thinking about killing yourself? Do you want to die? Are you safe? Be specific. Ask the difficult, uncomfortable question. Don't be afraid to ask. Because what's the worst thing that can happen? You ask, they say, no, I'm good. You're a little embarrassed, and we move on. We move on. Get over yourself. We move on. Ask the hard questions. That's what people who are depressed, who are anxious, or maybe they don't have a mental illness, but they feel hopeless. Those people, we people, need to know that we have permission to say, I am not okay today. Maybe not I'm not okay forever, but I'm not okay today. I'm hurting today. I feel hopeless today. I want to die today. My friend Sarah just wrote an article about a month ago for Relevant Magazine called I Love Jesus and Sometimes I Want to Die. That's the ugly, uncomfortable truth. Because we are not Jesus. Sure, we carry him with us everywhere we go, but we are human. We're not robots. We're not machines. We're not superhuman. Sometimes we feel at the end of our rope. Sometimes we find ourselves at the bottom of that deep, dark well. So giving people permission to say that is number one. Loving them through it. Letting them know that they are safe and that you are not going to run away when times are hard. That's the thing. It all goes back to loving your neighbor, listening to your neighbor, asking them if they're okay. What can you do? How can I help? Maybe having some resources. Knowing, oh, there's a counselor right over here, or here's the number for the hotline. Here's the suicide prevention hotline. Call this number. These people are trained to help, right? Now, here's how you don't ask. You're not thinking about killing yourself, are you? No. Don't do it that way. Number two, keep them safe. Reduce access to lethal means for those at risk. A toxic cocktail is this: depression or hopelessness and loneliness. So that person is depressed, hopeless, in mental health crisis, and you leave them alone. Oh my gosh, worst thing ever. You got to keep them safe. Number three is be there with them. listen to what they need. Don't tell them what they need. Don't try to fix them. You're not the doctor. You're not the Savior. You're just a friend being present, loving them in the midst of the mess.